Welcome everyone. Hello, I'm Gail Hogan, and I will be your moderator for this webinar. If this is your first time joining us, the purpose of this webinar series is to give you data, facts, and answers as we know them today to help you better protect your employees, customers, and your businesses during COVID-19. A few details before we get started. All attendees, with the exception of our speakers, are muted. This session is being recorded and will be available on our website. Throughout the webinar, you may submit questions for our experts through the question and answer feature in Zoom at the bottom of your screen. Here with me are experts from the Ohio State University Wexner Medical Center. Dr. Andy Thomas is the Chief Clinical Officer and Senior Associate Vice President for Health Sciences at the Ohio State University Wexner Medical Center. Dr. Thomas has worked on the front lines of Wexner Medical Center's response and management of COVID-19. Dr. Mysheika Roberts is the Health Commissioner for Columbus Public Health. Dr. Roberts leads a team of more than 500 public health professionals who are focused on neighborhood-based approaches to address health disparities. Like all of our panelists today, she has been on the front lines of the COVID-19 pandemic, and we look forward to hearing more about the COVID pandemic in our Columbus communities. Next, we have Dr. Leon McDougle. He is the Chief Diversity Officer at Ohio State's Wexner Medical Center. Currently, he is a national leader, currently serving as president of the National Medical Association. Dr. McDougle has both the local and national perspective on pandemic response efforts in communities of color. We look forward to hearing more from him shortly. Dr. Peter Moeller is Chief Scientific Officer and Vice Dean for Research at the Ohio State University Wexner Medical Center and College of Medicine. Dr. Moeller is directing COVID-19 based research for the Wexner Medical Center. And Dr. Ian Gonzenhauser is the Chief Quality and Patient Safety Officer at the Medical Center. He provides leadership and oversight of quality care practices and patient safety across the Wexner Medical Center. So we'll begin with Dr. Thomas. Dr. Thomas, welcome. And the news continues to reiterate that numbers are finally heading in the right direction. However, I know there's worries of new variants posing a threat to the community. Can you share with us the latest data and trends you're seeing? I mean, do you feel, you and your staff, that you can take a breath yet?
Gail, thanks so much for being with us again today. And thanks to all those attending our webinar today. It is a very different feeling now than just 6 or 8 weeks ago. It's actually kind of hard to believe it was only mid-December when we peaked in terms of both hospitalizations and new cases of COVID-19. That was just really 2 short months ago, and how far we've come. So in Zone 2, which is the Central Ohio and Southeastern Ohio region, where Columbus sits, we peaked at over 1,200 cases in mid-December, and we're down now under 300 cases in the hospital. In terms of our census of active patients in the hospital per day. And I think if you look at the case numbers across the state in terms of new cases being diagnosed, it's showing those same trends. So some of this is what we normally see when you see a spike and the spike comes back down. I will say in terms of our new cases per day, we are still higher than we'd like to be. We're still higher from an incidence perspective than we have been at some other points during the pandemic. The good news is that all of the same things that we've been talking about will provide protection for patients. And obviously, all those folks are your employees as well. It's masking, it's distancing, it's washing your hands, it's avoiding large crowds and kind of getting outside your bubble. But we also have what we're here to talk about today is a new piece of that puzzle, which is getting vaccinated and the ability to protect one not only from potentially not getting COVID-19 if you come into contact with someone, but the real benefit of the vaccine, which is preventing severe disease and preventing mortalities. It's a key part of the strategy of trying to vaccinate high-risk individuals that are at high risk for severe disease. And we do hope that in the long run, even if cases, because as you mentioned, Gail, even if variants become a bigger problem here in the United States or here in Ohio, if we have our highest risk patients vaccinated, we can certainly reduce the long-term negative effects from severe disease or from obviously from death. So we can talk a little bit more about variants a little bit later in the Q&A. But I think for now, I'll just turn it back to you so we can get into our discussion around vaccinations today. Thank you, Gail.
Thanks, Dr. Thomas. I do have one additional question, though, since we're talking about vaccinations. Are these businesses that we're talking to today, are they able to get vaccination information for themselves and their employees? And is there a way that they can help you and every medical official with these vaccination efforts?
Yeah, so a couple things I will say, and I say this on our town halls internally in the university and our town halls in the medical center. Part of the reason why we want to share so much information about how the vaccine works, including with the leaders from local businesses on the call today, is we want you to be a trusted source of information for your employees. We want you and your employee network to create an army of people that are motivated about the vaccine and can educate their friends and neighbors, because we do believe very strongly that the vaccine is safe and it's effective. And I'm not a believer in requiring the vaccine, but I'm a big believer in making sure that people understand the benefits of it for them and their personal life. So at this point in time, there are, I believe last I looked, over 800 locations in the state of Ohio where the vaccine is available. Here in Franklin County alone, there are nearly 100 locations where the vaccine is available in terms of local pharmacies, hospitals, health departments, and then eventually soon, doctors' offices as well. At this point in time, because the vaccine is pretty limited in terms of only being available for older individuals and only being available for people with certain medical conditions, I'm not envisioning a time anytime in the next couple of months where we're going to see employers having kind of vaccination drives on site at their workplace. However, and this is something we can talk about a little bit later, Dr. Roberts and I know we've talked about it, thinks a lot about it, is at some point this summer, when we've made it through all of the high-risk populations, we'll be in a situation where we have a high supply and low demand, because 20, 30, and 40-somethings may not be nearly as motivated as a 75-year-old grandmother to get in line to get the vaccine. And we're going to need all hands on deck to motivate people and understand that the benefits to them are, if they get exposed to someone and they're vaccinated, they may not need to quarantine. They can still come to work. Or certainly if you're doing any routine testing through your employment situation at your workplace, maybe they wouldn't need to be tested routinely if they've been vaccinated. So there's some real positives beyond the fact they may not get sick from the disease, which still may motivate people to get vaccinated.
Great. Thank you, Dr. Thomas. I appreciate it. Let's move on to Dr. Roberts. Welcome, Dr. Roberts. And your expertise is on social determinants of health, and you provide a solid foundation to begin our conversation about the COVID-19 vaccine and its challenges in communities of color. What have you found is working? You're on mute, Dr. Roberts. There we go.
Sorry. Thanks, Gail. Thanks for having me, and thanks for everyone at OSU, and good afternoon to everyone listening in today. So, you mentioned up front, and I think many of us know that this virus, COVID-19, has disproportionately impacted people of color. Black and brown communities have seen more deaths, more hospitalizations from this virus than other communities, disproportionately compared to the percentage of the population. And we also know, for a variety of reasons in the Black and brown community and access to care, that getting them vaccinating was going to be a challenge. But I think it was a challenge that all of us in public health and even in the healthcare field were up for and had some experience with in the past. So this slide here, you see, I'm just telling you a little bit about what the state's guidance is right now. We are in phase 1B. And for those of you who aren't familiar, who is vaccinated in phase 1B or who's eligible to get the vaccine in phase 1B, are adults over the age of 65 and individuals born with a list of specific medical conditions that they were most likely born with. They are eligible for the vaccine, as well as staff working in K through 12 buildings. And so at this point, the state is really focusing on how can we reduce mortality? And we know a lot of the mortality is in our older population and those with severe health conditions. And then how can we get back to some sense of normalcy by vaccinating our K through 12 staff so we can get our kids back into the real classroom? So that being said, Columbus Public Health was tasked with vaccinating our teachers in the Columbus School District, as well as Worthington, as well as private and parochials in our jurisdiction. We've been doing the majority of our vaccines at the Celeste Center, which is located at the State Fairgrounds. But we also have a mobile team that's been going out in the community and vaccinating some of those hard to reach populations, primarily in that 1A category. So these are individuals living in congregate settings and staff working in those congregate setting environments. Those individuals are not able to get to one of our clinics, and so we're going to them. And then just last week, we launched our weekly opportunity clinic, which is a clinic that is really focused on hitting individuals or providing vaccine for individuals who are living in our opportunity neighborhoods. And these opportunity neighborhoods are a series of zip codes that have high unemployment rates, low access to care, limited access to care, limited access to transportation, high infant mortality rates, and have a high need for health care. And so our first one was last week. We're having another one right now as I speak, and I'll tell you a little more about that in the coming slides. Thus far, we've given over actually 40,000 vaccines collectively at Columbus Public Health. Now we know, as Dr. Thomas just mentioned, we're not the only vaccine provider in Franklin County. There are close to 100 other vaccine providers. So this just tells you what we've done. As you can see, this data is as a few days ago. And so as of right now, I believe we've given about 42,000 vaccines. And of those, close to 14,000 have been second doses. So those are individuals who have now completed their vaccine series. So that's really good news. I'll go ahead and take the next slide. But I want to talk a little bit about this, the social determinants of health, as well as the issues with why African Americans are not getting vaccinated. You see here, African Americans are behind whites in vaccination rates. If you look at the state system, their data that they have posted, I think Franklin County or all of the state, they have African Americans, about 5% of African Americans statewide have received the vaccine. I always preface it by saying, if you look at the phased rollout of the vaccine, we focus with healthcare workers first, primarily in 1A, as well as some people living in congregate settings. We know that there aren't as many African Americans that work in the healthcare industry. So there weren't as many African Americans who were eligible for the vaccine in phase 1A. As we move to phase 1B and it primarily being age-based, along with K through 12, we also know African Americans have a shorter life expectancy, as do Latinos. For example, if you look at all African Americans just here in Franklin County, 92% of African Americans in Franklin County are under the age of 65. 96% of Latinos who live in Franklin County are under the age of 65. So we don't have as many African Americans or Latinos to get vaccinated with this age-based approach. But putting that aside, why are some African Americans or why are some Black and Brown individuals reluctant to get this vaccine? Well, there's mistrust with the healthcare community. There's mistrust with the government. There's a lot of misinformation out there. We know not all of them have good access to care, meaning they might not have insurance, or if they do have insurance, they don't have a primary care provider. They just haven't made that a priority, or they don't have insurance and don't know where to go. And then we can't forget there's been some historical mistreatment in the medical community that has affected the Black community, like the Tuskegee experiment years ago, and like Henrietta Lacks. And I also remind people, sometimes they don't even have to go that far back in history to see mistreatment by the medical community. They could just think about the last time they or a family member sought medical care and they didn't like the way they were treated. So vaccine hesitancy is real. We have to acknowledge it. And then we have to try to address it by asking individuals, what is it that's keeping you or making you reluctant to get this vaccine? I'll go ahead and take the next slide. So what is Columbus Public Health doing to try to overcome the vaccine hesitancy and try to increase the number of Black and Brown individuals who can get vaccinated when their turn comes? So it's kind of a three-prong approach. We're trying to increase access, we're removing barriers, and we're trying to improve communication and information. So with increasing access, I have dedicated 20% of the vaccine we get every week to go to vulnerable populations. And we do that in a number of different ways. We do it by providing it at our opportunity clinic, and we do it by going out to the mobile units. We're actually doing a really good job, doing the best job we can to collect race information. And I just want to give a point, and I know Dr. Thomas and I have talked about this, and Dr. McDougle will appreciate this. We had our first opportunity clinic last week at the health department. I was there. It was clear that 70% of those in participation who came were African American. But when we looked at the data from registration and individuals had to list their race, 49% listed their race as unknown. It's clear in the African American community that they're reluctant to identify as Black when they don't have to. And they're fearful that if they identify as Black, they're going to get less care, a less effective vaccine. They might be the first group that's called if there's a shortage of vaccine and have their appointment canceled. So they're reluctant to identify themselves. So it's really how we ask the question. It's so important how we ask the question. Fast forward to this week, we had a dedicated line just for the Opportunity Clinic. I only had 2 of my staff members who had great customer service enrolling individuals for their appointments. This week, 75% of those who are registered identified as African American. So it's how you ask the question, who asked the question, and it's that customer service. So our Opportunity Clinic is one way we're increasing access. And we're not only looking at our own Opportunity Clinics that we have here in Columbus, but we're also comparing that to CDC's Social Vulnerability Index, which takes into consideration income, race, and medical conditions of that zip code. We're trying to remove the barriers by having these mobile teams going out to a place-based approach. And then we know not everyone has access to the internet. And so we're allowing people to register by phone as well as online. In terms of information, and I'll go ahead and take the next slide, and how we're trying to increase information and engaging those vulnerable communities. We're using diverse community partners as our influencers to carry the message and get that out to the community. We're providing vaccine conversations. I've been on probably at least 24 WebExes or Zoom calls similar to this, talking to individuals in the minority community, whether that be the clergy, whether that be barbers and beauticians, whether it be educators, whether it be sororities and fraternities, trying to increase the messengers, because I know there are a lot of valued members in our community. They don't always need to hear from a person in a white coat or someone in public health. So we've been doing a lot of that. We're also partnering with the city's Department of Neighborhoods to engage our community and provide boots on the ground. You know, we have to do this kind of old school, as I like to say. We can't always depend on social media and the media market. And then the city and the county, as well as our hospital systems, are launching a community multimedia campaign, and it has a special focus on those in the underserved communities. I'll go ahead and take the next slide. So I want to tell you a little bit about our Opportunity Clinic, and I'm glad to hear we're not the only ones, and Dr. Thomas might share some of the work that OSU is doing as well. But we're targeting these at-risk neighborhoods. You can see the zip codes there. We're having this clinic at Columbus Public Health. As I mentioned earlier, the majority of our vaccines are being distributed at the Celeste Center. It's a drive-through clinic. Not everyone has reliable transportation. Not everyone feels comfortable doing a drive-through clinic. So we really wanted a targeted approach to focus on residents who live in these zip codes, to give them a dedicated phone number to register, make sure they're aware there's transportation available if they need to get here. We're also on a bus line if that's more comfortable and convenient for them. As I said, last week we vaccinated 135 individuals. This week we should be vaccinating over 150. This will be a weekly clinic that we're going to do, continuing to focus on those zip codes that we know have an increased need for healthcare, but most importantly for protection from COVID-19. I'll go ahead and take the next slide. And that's it.
Dr. Roberts, thank you so much. And I have a follow-up question here. All the efforts that you have begun, have you seen results?
Well, I definitely think we have. I mean, clearly when I said, last week we had 49% say their race was unknown, and this week we've had 75% say that they are African American. That is, to me, saying things are moving in the right direction. What I'm learning through this process is many in the minority community are appreciating the hands-on approach. They want, kind of a personal invitation versus this blast email, blast messenger approach. So again, using community ambassadors, agencies that they know, people that they know, to invite them to come to our Opportunity Clinic has been advantageous for us thus far.
And moving forward, when you look at the future, are there any other ideas that you want to implement to make this go even smoother?
Well, absolutely. I mean, like I said, we want to try to do some place-based approaches. And so we're going to go out in the community and bring our vaccine to them. And, particularly we're looking at going to some churches. We're looking at targeting locations that we know will get a good response from the Somali population, as well as the Latino population.
Wonderful, Dr. Roberts, thank you. And I know you'll join me for the question and answer a little bit later in this webinar. And I do want to remind folks that we are recording this webinar, including all the slides, so that if you want to share this, or again, watch it yourself to get this information, it will be available to you. Now we're going to turn to Dr. McDougal. Dr. McDougal, are there best practices that Central Ohio businesses could implement to support their employees that are most affected by this pandemic?
Yes, very good question. And if the facilitator could put up the slide concerning an example of what we're doing here at the medical center. So complementing Dr. Roberts' access improvement with the availability to undergo vaccines, we also have established a similar station at OSU Hospital East, and really focusing on the zip codes you see here below of communities made vulnerable by COVID-19, and you see the hours of operation there for your reference. And I think we can just leave this up while I just talk here for a few minutes. So I'm the president of the National Medical Association, and we've been convening national town hall meetings, and we participate as a member of the Black Coalition Against COVID. So I would ask that the businesses use that as a reference. That website is full and rich with wonderful resources speaking to the Black community, engaging leaders and stakeholders from Dr. Kesmekia Corbett, who is the lead virologist who developed the messenger RNA platform, to representatives from the Food and Drug Administration, to Dr. James Hildreth, president of Meharry Medical College, and who sits on the FDA Oversight Committee. I also chair the National Medical Association Task Force on Vaccines and Therapeutics, and we've met with the scientists from Pfizer, from Moderna. We're meeting with Johnson & Johnson / Janssen and AstraZeneca. And so we released an advisory statement on December 21st concerning the Moderna and Pfizer vaccines from the viewpoint of Black doctors caring for people in the Black community. And I would also advise and recommend that you use that as a resource to share with your employee and your workforce. And to follow up on what Dr. Roberts stated, and I'll come to an end here, setting up opportunities to have a conversation with the workforce, with trusted people within the communities in which your workplace exists, setting up opportunities where questions can be answered. I've found that answering questions and not having a top-down directive voice in this is a wonderful way to help decrease vaccine hesitancy across all groups. So those are my thoughts, Gail.
Dr. McDougal, thank you. That leads me to a question, and even though you advised employers to go to this website for information, you just gave a concrete example of what they can do by possibly bringing in medical folks to address physically to them what they could do with the vaccine and how it's safe. Any other ideas that are tangible that you could share with our business leaders right now?
Yes, so now I'll refer back to Dr. Martin Luther King and his book entitled "Where Do We Go From Here? Chaos or Community?" And he speaks to the pillars of the Black community to address difficult issues in challenging times. So who does he refer to? The Black church, the Black media. So when we're making these buys, these marketing buys, turn to Black radio, turn to the Columbus African American, turn to those radio and television outlets that have a large audience of the people that we're trying to reach. Also, Black fraternities and sororities and professional organizations. Here in Columbus, for example, we have one of the strongest Links Incorporated chapters in the country. Also, Jack and Jill Foundation of America, the Urban League, the NAACP. So we have those groups that we can partner with to advance this cause. And actually, the president of the NAACP on our town hall with the Ohio Department of Health Monday stated that we should almost treat this like a political campaign where you have caller banks and outreach to the community one by one. It's a ground game.
And speaking of that, it has to be beneficial to have Ohio State East be in the community to help these folks right where they live.
Yes, not only East, quiet as it's kept, OSU Wexner Medical Center is in the community, the Wineland Park area, the University District. We are in the heart of the city. And also our partners, Mount Carmel Health System, Ohio Health, and the VA. So we're all in this together, all hands on deck. So very good. Thank you for allowing me to expand on that.
I was going to say, it sounds like all hands on deck. Dr. McDougle, thank you. I'd like to bring all our medical experts back up so that we can open this up to some questions, so we can see you all again and hear you, please. And Dr. Moeller, we're going to welcome you, and I'm going to ask you the first question because it's been a question that I know I've been hearing it. It's about the vaccines and the variants. And I know because everything is new, there's still much up in the air, but do we know anything more about how long the vaccination will lead folks to immunity? And do we know yet if we'll need boosters?
So I'm going to let my colleagues talk a little bit about the how often we're going to need vaccine, the boosters. I maybe can comment on the variants if that's good with you all.
Please do, yes.
So I think, one thing that we're hearing a lot on the news, every time you turn on the news today, you hear about variants and what do variants mean. A couple things for the work group today. The first is that all viruses mutate and all viruses go through this process of creating variants. This is something that we've seen since the dawn of time and something that we'll see very likely post-COVID. Like other viruses, this one is mutating, and we have seen an increase in this mutation rate. Again, this is something that we were expecting and something also that the people that make the vaccines were expecting. The way these vaccines were designed is not against a small, tiny little piece of the protein, but against a very large piece of the spike protein. And they've done it in a way that your body creates, or your immune system creates, antibodies against big parts of this protein. And so as of today, we believe that these vaccines are still going to be very effective. Now, we are making sure we keep a good line of sight against what's happening against these viral variants. We think some of the variations create viruses that can be more infectious. We also think that there's some forms of these that can make the virus replicate faster or more efficiently. With that said, again, the very good scientists that were involved in creating these vaccines and the people that are studying them are working already to create ways to make boosters or create ways to make these viral vaccine designs more effective to compensate for some of these variations. So at least today, the data is very early, as you mentioned, Gail, and very, very early. We're thinking that the vaccines, while they might lose some fractional ability to be responsive to the variants or the viruses, that we still feel very good about the need to get vaccinated still. I don't know if Ian or Andy want to comment on that.
Yeah, sure.
Ian, you can go ahead.
Yeah, I'll jump in and comment on the first part of the question regarding boosters and what that looks like moving forward. Unfortunately, we just don't know yet. We don't have a lot of great information to work with as far as how long immunity will last and what a booster scenario may look like. Our hope is that the general public and everybody who becomes eligible for their vaccination proceeds to receive their vaccination, and that we can continue with the current risk mitigation mechanisms that we know are working, and that drives COVID numbers right through the floor to where we have very, very minimal community impact. If that happens and we're able to drive cases very, very significantly down, and we don't see significant community incidents any longer, there may not be a need for booster because there may not be, much of a significant COVID risk or threat anymore. So that's one scenario that could potentially play out. On the other hand, we may find that COVID lingers and cases linger in the community because there's incomplete acceptance of vaccination. And if that's the case, then the length of time that immunity lasts is going to become very important. We'll look very closely at that and try and determine based on that and our ability to continue to keep risk low for individuals contracting COVID, that a booster situation may come into play. So, like many things throughout the past year, we continue to learn more and more every day. There's a lot of learning that's taking place, and this is one of those things that we're just going to have to wait and see and really be able to make a determination once we have more data.
Yeah, Gail, if I could add one thing about the variant. One thing that's really important to recognize, even though as was just discussed, variants may be more contagious, what that actually means is if you come into contact with someone who has COVID and you're not wearing a mask or you're not protecting yourself, you can come into a lesser amount of the virus. And because it may be stickier to your mucosal membranes, you might be more likely to get it than if you came into contact with someone who had the old version of the virus. The transmission of the virus is still the same. It's still in little particles and little droplets that go from my mouth or nose to someone else's mouth or nose. It's not like you now can get it from a completely unrelated thing. We're still talking about the same virus. The transmission's the same, so the things that protect you are still the same. If you don't come into contact with someone because you're not in that large group setting at an unsafe party or outside your bubble, you're not going to get it, even if there's a variant. If you're wearing your mask, if you're washing your hands, if you're keeping your distance, you're still protected. It's just if you happen to come into contact with that virus, less of it will now get you sick, we think, from the variant. So it's just important to remember, it's not like it's a game changer and that now you get it by watching television. I mean, it's not like it's a completely different thing. It's the same virus. It's just a little stickier. So if you come into a slightly lower concentration of it, you still might get infected compared to the old version of the virus.
And Dr. Roberts, let me ask about who is getting the vaccines at this point. And I know there are folks that say the CDC recommends essential workers should be getting it. Who makes that decision of who's an essential worker? Does the city health department have anything to do with that?
No, thanks, Gail. It's funny that you asked that. I was asked that question last night on another event, and the city health department does not make that decision. Those decisions are all made at the state level. So the state health department and the governor's office are making those decisions, and they're following the data. So they're looking at where we've seen the greatest percentage of our mortality or death from this virus. We saw that a lot in nursing homes. We saw that a lot in our population over 65. And so that's what's driven their decisions for 1A and 1B. So we're waiting to see what's going to happen next, who's going to be the next group, which will likely be called 1C. But we have heard from the governor that it's likely going to still be age-based. So we think we might go down to 60 at some point. And I think he is contemplating, he and the state health department, could it be sector-based? Whether it's essential health workers or other sectors of our community should be vaccinated based on risk of what they're doing and their likelihood of being exposed to this virus. And then as a provider, whether it's our health department or OSU, our jobs are to follow the directives of the state.
Dr. McDougle, does the worry of variants add another layer of anxiety to the communities of color and their hesitancy?
So it's a variable. I think now there's a transition in regards to there's a decrease in hesitancy and an increase in willingness to receive the vaccine. And in some cases, I've heard the term used, vaccine envy. And in fact, this week, one of my patients sent me a MyChart message. She's 60 years old. She saw the Ohio Department of Health virtual meeting and said, I'm concerned. I think it's unfair that I'm not able to get the vaccine. So she's 60. So that, thanks to Dr. Roberts for bringing up that term. And we've seen even from national surveys from the Kaiser Family Foundation in September, 50% of Black people were willing to get the vaccine. December, 62%. And with the ground game that's going on with Dr. Roberts and OSU and all these national meetings we're having, I think we're having an impact. So thank you for asking that question.
Gail, along those lines, one of the things that I think it's been interesting just psychologically about all of this is how the scarcity phenomenon has driven the passion of people to get this in a way that I'm not sure if it was available on every street corner that we would have. That being said, I think as soon as we have enough supply, and I think the good news is we're hoping to now have a third vaccine candidate approved here in the next couple of days. The K through 12 teachers are done being vaccinated at the end of this week. So locations like the Schottenstein Center or OSU East or the Columbus Health Department are hopefully going to be getting more vaccine over the next 2 to 3 weeks than we've even had over the last couple of weeks. And then as we can then, we'll be able to look at moving down either that age spectrum or into other essential worker categories. But it's been an interesting psychological thing to watch to exactly what Leon just described of the scarcity phenomenon driving behavior. I'm sorry, Peter, you were going to say something.
Yeah, great points. I was just going to echo something that was brought up earlier that would like to just re-echo is to really spend time with your groups tracking down all of the questions and answers and not just saying vaccines are safe, the variants aren't a huge deal, spending time of saying why, really getting deep into the questions of, these are some of the things that you're going to hear across, the news, or you're going to hear from your colleagues about vaccine safety. These are some of the things that you're going to hear about potentially that the vaccines were developed too fast or weren't tested, and really taking the time, in your teams and in your companies and in your churches and in your friend groups to really get educated on yourself on how these vaccines were developed, or to Dr. Thomas's point earlier, that it's not that these, you're going to get infected from your TV. So again, not simply saying it's safe or you're not going to get it, but why? And we have developed a number of seminars. We've developed a number of slide sets. We're happy to go on the road. This is something that is an incredibly important public health issue, and we're all happy to spend time on nights and weekends to talk through your teams about educating them on things like vaccine safety and public health and epidemiology.
Yeah, Peter, I was going to mention this at the end, but I think it's, given you brought it up, I think we can mention it now. Just a reminder that part of what we're trying to do with these relationships with local businesses is to help you. And sometimes in the fall, that was about testing, or now it's about vaccine, or back last spring, it was about how to set up your manufacturing floor to make sure it was safe with distancing and plastic barriers. So, COVID-19 Consulting at osumc.edu is the email address if you want to reach out. We do have the ability of multiple different levels of providing consulting to your business. We have at this point, these webinars are free. We post them online. They're obviously available for any business or any individual to look at. But we have a variety of ways, either through phone consultation, through Dr. Gonzanazer and I have dropped into different COVID task forces across Central Ohio and different businesses, and we're happy to come and spend an hour. And we're even able to do on-site consulting where we can come out to your business and talk. Now, there are different price points for each of those things, and whether you have an infection control nurse or a physician doing that consultation, but we're very happy. I think the virtual technology makes that even easier in terms of commute time. And I'm going to turn to Ian for a second to talk about the train the trainer approach, which I think also can have some help around vaccines to train people internally in your organization.
Yeah, sure. Thank you, Dr. Thomas. As we've developed these relationships with particularly the business community and other entities within the Central Ohio and Ohio communities, we've really wanted to try and help to establish and advance your capabilities in managing the pandemic and pandemic-related issues internally within your organization. What we find frequently works best is when you take guidance and principles and evidence base and you internalize that and integrate that into your local work processes or your environment or culture within your organization. The best way that we've come up with to do that is to be your provider of expertise, to be your clearinghouse, if you will, of many of those guidelines and much of that evidence, and bring that to you in a way that is packaged and accessible and easy to process, and again, then integrate into your workflows. One of the ways that we are doing that, obviously these webinars and our consulting that we perform, but also in actually training an on-site member of your team to really be your local point person, your local expert within the organization. Again, in doing so, we provide them the foundational information, some of the basic education around viruses, virology, pathogens, infection control, infection prevention, and really arm them with the knowledge that they can serve as sort of your first best contact as you're establishing policies and protocols for your organization. Again, much of this is nuanced, much of this is behavioral. It really requires our ability to connect with your workforce, for you to connect with your workforce, and install things that are going to be easy to adhere to within your environment. And we know all environments are different, and cultures within organizations are different. And so the best thought for us is, again, being able to educate somebody within your organization to be that person who can serve as your lead for this. And we've developed a 3-hour, essentially, train the trainer program. We may actually even be able to shorten that slightly with some feedback that we've gotten through our pilot program. And in a very short period of time, again, be able to provide our expertise to a member of your team who can serve in that capacity. We follow that up with continued support, ongoing support with whoever we train, so that they can have the latest and greatest information to continue to advance your approach to this, and hopefully get your workforce, as safely and as kind of quickly back to normalcy, if you will, as possible. It's going to be a long road ahead. There are going to be a lot of challenges and a lot of different nuances that we have to work through. Things are going to change continually as we learn more. But I think we have a great program and a great process and something that can really give you a significant advantage within your organization.
Dr. Roberts, I have a question for you concerning the fact that COVID-19 has shined a light on the fact that communities of color many times are underserved when it comes to medical related issues. So do you see now that COVID-19 has highlighted this, that there may be some changes in the future about all kinds of care for communities of color?
I'm very optimistic about that, because I think this pandemic has really ripped the Band-Aid off of the disparities that many of us in healthcare knew existed. And now, whether it's the business community, politicians, and others have been able to see it firsthand, as well as those communities who, let's say, are advantaged and might not have appreciated it as much. They are also able to see it. So I am very optimistic, and I'm already starting to think of how we can capitalize on what we've learned during this pandemic to help improve healthcare delivery post-pandemic.
And I'm not sure who's to answer this question, but one of our viewers on this webinar wants to ask about the fact that they've lowered the rate, or they've lowered the age of people to get the vaccine, and yet there are folks who are above 70, above 80, who are still waiting for the vaccine. And they're wondering if maybe we've rushed it too much and not given some of these older populations more of a chance to get that vaccine.
I can take that one, Gail. It is kind of interesting. We were just discussing this on a call this morning with the Ohio Department of Health. If you look at the individuals that are over age 80 in the state, at this point, even though they've had 5 going on 6 weeks to get vaccinated, right now at this point, only about 60% have been successfully vaccinated. And I think what we're all trying to figure out is, why is that? There are certainly, we knew there was probably not going to be 100% uptake of the vaccine, but I would have thought for that group, we would have been closer to 75% or slightly higher. We do think there is still some lack of access to the vaccine. That's exactly why, as Dr. McDougle described earlier, we have opened up our vaccine clinic at East, focusing only on certain zip codes where we do think the accessibility is lower. When we had our first, out of the first 230 people that signed up for a vaccine here at OSU East, that's where I'm actually at today at our vaccine site. There were 45% of those patients were Black or African American self-identified, and a total of 55% were non-white non-Caucasian from the zip codes. That compares to about 9% at the Schottenstein Center. So we do know that there's a demand in these zip codes, in these neighborhoods, for probably different types of access. So we are, I think, all trying, whether it's Dr. Roberts through Columbus Public Health or our colleagues at Ohio Health and Mount Carmel, trying to make sure that we're better serving different groups in different ways. We're just talking about race and ethnicity here today. In terms of the movement, no one's saying tomorrow we're moving to under age 65. I think it's still a few weeks out. We are going to have more vaccine available in the state over the next couple of weeks. And I think if you look at the groups that haven't signed up in the 65 and older group, it's probably around 600,000 or more individuals that still yet need to be vaccinated, or that we would expect based on routine uptake rates. So that's 2 or 3 more weeks of vaccinations. But I do think at some point that will be the next step down. As Dr. Roberts said, it's going to go down to the next age group.
I'd like to chime in on this too. So I am from Ohio, and my mother lives in Erie County, Ohio, Sandusky, and I do think there's a digital divide, and I brought this up with Jamie Carmichael, and she recommended using the Ohio Area on Aging organization to also help break down those barriers in regards to the digital divide. And because, you know, and I'm going to coin a term, the mom test. I ask you, especially if you're in your 50s, was your mother able to navigate the system? And because web-based access and even the phone banks and so forth, they're difficult to overcome those barriers. People are having difficulty. So I don't, and we have 88 counties in Ohio, and they have different access to stations and so forth giving vaccines. So I just want to bring in the diversity of geography and access from small towns to rural areas to urban communities to bring that into the discussion.
And if I could just piggyback on what Dr. McDougle said, you know, the Ohio Office of Aging is very important. And in Franklin County, we have utilized the Franklin County Office on Aging to help identify individuals who are 65 and older, reach out to them, help them register if they need registration. And I know something we're getting ready to do, and I believe OSU has done it already, going out in the community and finding people where they're convening, even though people aren't convening that much anymore, but finding people in their churches or senior centers and encouraging them to get vaccinated and registering them right there on the spot, so they don't have to call in or go online and try to navigate that website.
Thank you all. And I do have one more question for you, Dr. Moeller, only because it's come up in the news recently about the third vaccine, Johnson & Johnson. And now there are people that say, well, I want to choose which vaccine I get because it may not have quite the efficacy as the other two. Well, what do you say to folks when it comes time to vaccine? Can they pick and choose like shopping?
You know, until this is still a very scarce resource. And I think, I always talked back to where we were a year ago, you know, and if you looked at me, and I'm a scientist, and I spent a lot of time in the lab and thinking about these things. If you were to say we would have one vaccine that was at least 50%, I would have been over the moon. And today we're looking at 3 vaccines that are above, you know, significantly above that. And you know, we are in a very good position to where we were a year ago. You will very likely for a number of months not have control over which vaccine you're going to get. And we should be very grateful then when we get these that they're available. I will also say, and Dr. Thomas mentions this a lot, when you go in to get your flu shot every year, you likely don't know what brand you get a flu shot, right? And very likely going forward, you're going to have your COVID vaccine or you're going to have your COVID booster. So, you know, the vaccines are all very safe. They work a little bit differently. You know, you're not going to get one your first time and your booster is going to be a little bit different. They're all tested a certain way, but I'm really pleased at where we are in March of 2021 with what we have available. And And I hope others feel the same way. I don't know if my colleagues would want to comment as well.
I'd be happy to comment. I think not only do you not know what brand of flu vaccine you get, most likely it's only about 50% effective. And a good year maybe is 60%. And now we're worried about a vaccine that with a single dose is only 70% versus 90% effective. People never focused on this before COVID. One thing I will say, just in all seriousness around the J&J vaccine, if you look at the data, even though it may have a lower percent effectiveness rate, what that means is effective at completely preventing you from getting the infection. In that J&J study, there were 0 deaths and 0 hospitalizations from those that received the vaccine, even if it's only 70% or so effective. I just think I cannot emphasize that enough, that the key elements of this is to not die and not get seriously ill from the infection. And that vaccine, regardless of what percent you put next to it of effectiveness, showed that it did do that in the trials.
Well, thank you all very much. We're going to wrap this up. And as I do, I want to remind folks, as you've heard from the medical staff on this webinar, if you'd like to connect with the OSU team to further explore partnership opportunities for your business, here's the email address. It's COVID-19 Consulting at osumc.edu, COVID-19 Consulting at osumc.edu. And also mark your calendars for our next webinar that is scheduled for March 19th. 9:30 in the morning, featuring Dr. Nora Colburn when we discuss vaccine safety and efficacy. And I would like to thank each of you in the audience for joining us this afternoon. And of course, our guests today, Dr. Roberts, Dr. Gonsenhauser, Dr. McDougle, Dr. Thomas, and Dr. Moeller. Thank you all again for being with us. And once more, if you'd like to connect with the team, there's the website. Thank you all again. Be safe and be well.